Digoxin is a cardiac medication belonging to the cardiac glycoside class. It is used to treat congestive heart failure in combination with a diuretic and ACE inhibitor. It also can be used to treat heart rhythm problems such as atrial fibrillation. It works by slowing the heart rate, increasing the force of myocardial contraction, cardiac output, renal perfusion, and urine output. It also decreases edema. Serious problems like digoxin toxicity can happen if you don't follow your doctor's advice. Symptoms include irregular heartbeats, bradycardia, heart block, dizziness, severe nausea, and vision changes. If this happens, call your health provider ASAP. Some toxic symptoms include the yellow halo or vision changes, malaise, heart block, A-flutter or AFib, VTAC, and hyperkalemia. Digoxin can be given orally, intravenously, or intramuscularly. Your doctor will tailor your dose, but it usually comes in 0.125 to 0.25 milligrams daily by mouth. Remember, more isn't always better. It's all about the right balance. When we're pushing it through an IV, we can do it slow, over 5 minutes. 1 milliliter of digoxin for every 4 milliliters of sterile water. The antidote for digoxin is Digoxin Immune Fab, or DigiFab, and it is given via IV infusion. Continuous cardiac monitoring during this and after infusion is important. Some drug-to-drug interactions with digoxin would include amiodarone and tetracycline. They increase the effects and risk for toxicity. Some contraindications with digoxin are heart block, acute MI, renal insufficiency, and electrolyte abnormalities such as hypokalemia or hypomagnesemia. Nurses, remember to assess apical pulse for 1 full minute before giving digoxin. If it's below 60 beats per minute, hold the dose and call the doctor. Remember, digoxin levels greater than 2.4 is toxic. Normal is 0.5 to 2.0. Teach the patient how to monitor their pulse and when to hold their medication. Patients should be weighed daily and report weight gain or loss of 3 pounds or more in 1 day to their provider. Monitor potassium levels and digoxin levels for signs of toxicity. Considerations with pediatric patients include risk increase for toxicity because they have a smaller body mass and immature kidneys. Dose must be checked by 2 nurses. Check for hydration and electrolytes. Must have apical pulse for 60 seconds. Infant heart rate less than 90, we're going to hold that. For children less than 70, we're going to hold that one as well. In elderly patients, there's also a risk for increased risk for toxicity due to their aging kidneys and smaller body mass. They typically need a smaller dose, and we're going to hold the medication for less than 60 beats per minute. We're always going to monitor that renal function and check for hydration status with their electrolytes. Take digoxin exactly as prescribed. Avoid skipping doses or doubling up. Do not stop abruptly. Watch for signs of toxicity and stay hydrated. Increase high potassium foods in your diet such as bananas, avocados, spinach, potatoes, and beans.
See if digoxin is right for you. Call your healthcare provider today.